Hello everyone, this is Dr. Ashish Shah. I am a neuropsychiatrist and I deal with all kind of mental and behavioral issues ranging from depression, anxiety, bipolar, schizophrenia to developmental issues in children, ADHD, autism disorders. I also deal with geriatric population problems like memory losses, dementia, psychosis. Apart from that, we also deal with de-addiction like cocaine, heroin, cannabis, alcohol, smoking addictions. But today I am here with a very common topic called depression, which is generally used very commonly without actually knowing what depression is. So depression actually is a syndrome consisting of three core symptoms. First one being low mood or sadness. The patient is in the low mood all the time, is sad, sometimes can cry or weep because of problems, has a negative thinking towards the world. Second thing, what appears is generally when they wake up, they have low energy in the mornings. They feel very lethargic to do anything. Apart from that, they have anhedonia. It's called lack of interest in pleasurable activities. For example, if a patient is in depression, they won't enjoy watching movies, playing cricket, listening to music or whatever their passion is. Apart from this, there can be other problems also like lack of sleep. There can be disturbed sleep, they wake up in the middle of the night, they can have decreased appetite also. Apart from this, there can be suicidal ideations. The patient could feel that being alive in this world is not worth, and they might also plan for harming themselves or planning a suicide attempt also. So that is there is lack of confidence, there is negative approach towards self and others. So all these symptoms are there. If these symptoms are present for more than 2 weeks, we can identify depression in the patient. So whenever you feel that someone around you or near and dear one is suffering with these symptoms, please contact an expert. We have a psychiatric setup where we can help you properly. Apart from depression, there's one more thing which is very, very common. It's called anxiety. Anxiety is also very commonly used by everyone without knowing the proper symptoms. So what happens in anxiety? Anxiety is a state where patient starts feeling restless and breathless all of a sudden. They have shortness of breath, they can have palpitations, that is increased heart rate. With that, they can have sweating or shivering. They feel very restless and sometimes they go into panic state. What is panic state? And the panic state, the patient feels that they are going to die any moment. Generally, such patients in panic are rushed to the hospital emergencies. While there, we tackle the patient and they become stable within few hours. So, apart from this, the patient in anxiety can have several symptoms ranging from head to toe. They can have headache, they can have blurring of vision, they can have dry mouth, they can have gastric upset with loose motion or constipation. They have several tingling or numbness sensation in their bodies. They can have pain in the back and neck and burning sensation in the feet. So all these symptoms can be triggered by anxiety. They cannot be just justified by being different systems problems, but they can be because of generalized anxiety disorder. So it's better to be informed and aware of these problems so that whenever someone is suffering, you can help them. Thank you.